Hi, I'm Dr. Gregory Carroll with Clinexus. So it's 2 a.m. and I'm an emergency physician in our community hospital. It's my turn as a partner to work a night shift. One of my other partners in the group had signed out his patients to me about 2 hours before without incident. I had the great team on that night. Kim, my charge nurse, she anticipated my every move without a word. Bryce, our clerk, who's now an emergency physician, had orders in before I'd even thought of them. So I was looking forward to this night shift with the A-team. As a group, we had great relationships in the hospital, with the hospitalist service, with administration. We sat on committees. We set strategy for the hospital. We were dialed in. And this is not uncommon. Typically, this is what you would see at a community hospital: coordination, communication, cooperation. So that night, about 10 minutes later, we were contacted by EMS. They were en route with a 70-year-old patient who was unconscious. We mobilized. We were in the treatment bay as they hit the door. Everything was in place as it always was. I knew exactly where every device that I needed was placed without even looking. I was at the head of the bed. As always, Kim was over to the left. The patient was rolled in, and we then proceeded to work on her for 2 hours. We could never revive her. Unfortunately, I had to pronounce her dead. I then wanted to look at her medical record, as she was discharged 2 days previously. I went into the EHR. The notes were meticulous. The care was impeccable, textbook. All of her labs had normalized, her vital signs when she was discharged. I then took a long walk down the hall to sit down with her husband and inform him that his wife had passed. I sat there in silence as he wept. And when he recovered, he wanted to thank me for the care his wife received in the emergency department. He also wanted to highlight how impressed he was with her care in the intensive care unit the days before. The cooperation of the staff anticipating his every need and his wife's every need. When he took her home, he pulled the car around. They handed him the discharge instructions and he drove home. He was fatigued, both he and his wife. It had been a long week. He knew the cupboards were a bit bare, but was too fatigued to stop for groceries that night. He had glanced at her discharge instructions, knew there was a prescription to fill, but the 24-hour pharmacy was across town. They got home, they went to bed, they woke up. He filled her prescription, but she'd missed a couple doses. They were able to cobble together a couple meals with what was in the cupboards. And then over the next day, she became ill again. And that's when she presented to us in the emergency department. He communicated that he felt like he couldn't catch up. He knew what he needed to do, but he couldn't catch up. He felt like he was reacting to the situation. And in my mind, I knew that I felt the same way when she rolled into the emergency department late that night, early that morning. As a clinician, you never want to be reacting. You want to listen, but you don't want to be reacting. You don't want to be on that back foot. You want to be anticipating. And what he described and what I experienced was that reactivity. What he observed in the ICU was the proactive care, right? Anticipating needs. And that's how we're able to deliver such high quality care in the hospital environment or the clinical environment. But when the patient steps out of that environment, there's just a huge drop off in terms of what we're able to do. And it's not the nurses or the doctors, they absolutely want to provide the same level of care outside of the hospitals they do in, especially until they follow up. But they're unable to. They don't have the visibility into the community, to the patient's life. So instead of proactive care, we end up living under the tyranny of being reactionary or reactive. But there's a way out of this. We can do better. The actions of CMS, the governing body that dictates how care is paid for, which drives how we deliver it often, as well as the systems that deliver that care, is focused on these care transitions, these times of vulnerability for patients, and supporting and paying for these services. We also now have companies like Amazon Pharmacy, where we can get this patient their medications before they even return home, within an hour, properly dosed, so they don't have to worry about dosing and timing and those elements. Instacart Health, where dietary needs can be communicated and groceries sent to the home before the patient arrives home. Uber Health for transport. These are nice building blocks to start, but we need more. And a key element of this is where we see our opportunity at Clinexus. More and more care is going to be delivered at home. Patients are going to be sent home sooner. So the fidelity and the harmonization that we need around coordinating these services will become paramount. Patients will be going home more ill with more needs. And this is where we see our opportunity. We want to be the proactive care coordination partner of choice for health systems and primary care networks and payers. Our team of virtual care coordinators that are powered by our proprietary software tools for clinical decision-making and coordinating complex care. And over time, as we develop predictive analytics based on the data that we collect on large patient populations, will allow us to do that. We've built a team that individually have done great things in the digital health space and the care coordination space. One of our team members led the build out of Mayo Clinic's entire digital platform. One of our team members built a 150 urgent care network across the US that were deeply integrated with health systems. So we've built together a team that can deliver this on this vision. I want to ask you to join us, clinicians, entrepreneurs, investors, join us. Because there's one more thing that I want to bring up and I want to leave you with. Our goal is that no patient is lost to care transitions as the patient that I described to you earlier. I want to thank you for your time, and please do join us on this journey. Thank you.